Flare-ups are a really common part of anyone's recovery process and something that we want to talk about to help you understand them. Because no one's recovery from being in pain to 100% is a straightforward process, and neither is it a linear process. You're gonna have some peaks and troughs along the way, and sometimes we liken the recovery of any patient to that of the stock market, where you'll have your daily highs and lows, and it's really easy for people to get stuck in that day-to-day, oh well, today's a good day and tomorrow might be a bad day, and so I'm not really getting any better. But what we want to do is try and zoom out and get a perspective over the last month, 2 months, 3 months of how are you doing overall, just like in the stock market where you'll see a gradual increase over a longer time span. So by that means, we want to create targets and goals for you and see, can you now do things that you couldn't do 2 or 3 months ago? So that's the first marker that we want to use to see how you're getting along. But what causes these flare-ups? Well, many factors can cause a reoccurrence of pain, and some of them aren't actually so bad. Because as you try to unlearn that pain behavior, if for example I have some pain in my back and treatment allows that back to move a little bit better, and so the way that you move becomes a little bit different. But as a byproduct now, the other joints are also moving differently, and they may have preferred how it was in the first place. And so sometimes old injuries can almost flare up. And this is where the analogy of recovery being like peeling back the layers of an onion. Because as we take away one problem, sometimes it might highlight something else. So it's not necessarily a bad thing, it just shows us the next thing that we need to deal with until all the areas are able to work efficiently together. Just like if I have a knee problem, there's no point just looking at the knee, we need to look at the ankle, knee, hip, low back, pelvis as a whole unit so that it can use the whole movement capacity as one. So really that's the most important thing to think about with flare-ups.